Hi everyone, welcome back to GCSE. We're going to be carrying on with some organisation today and looking at coronary heart disease. So we're going to be looking at what coronary heart disease is, what causes it, the effects it has, and how we treat it. So as always, grab some paper and grab some pens and follow along with me. Okay, let's start with looking at what coronary heart disease is. We've got some big confusing terms here, so we'll try and get through them as we go. On the outside surface of the heart, there are lots and lots of blood vessels crisscrossing over it. These are called the coronary arteries, and these are actually the heart's own blood supply. You might think that the heart can get blood because blood's always moving through it, but if you stop and think about it logically, the blood that's moving through the inside of the heart is going so fast that it will not have time for that oxygen to diffuse into the actual muscle tissue the heart's made of. And now, seeing as the heart's made of muscle, it's going to need a lot of oxygen and a lot of glucose to contract and beat. So it has its own blood supply around the outside that is exclusively for the heart, and that's what the coronary arteries are. So if we take this term coronary and we think about coronary heart disease, logically that means that coronary heart disease are conditions that affect the blood supply of the heart or affect those coronary arteries. So that's what coronary heart disease is. Let's have a look at what causes it. Now, heart disease is one of the biggest killers in the Western world. It affects people in developed countries more often due to our high-fat diet and our tendency to not do as much exercise as we really should. So, the three main causes of coronary heart disease are unhealthy lifestyles, so we're talking about smoking, drinking too much alcohol, not getting enough exercise. Poor diet also contributes, so having food that's especially high in fat and cholesterol, or an unbalanced diet, so one that does not contain all the nutrient groups you need for good health, and also having a diet that has high cholesterol in it. Now, cholesterol we need to go into a little bit more depth, because I think people get a bit confused about what cholesterol is. I'm sure you've heard of it before, and you've seen those adverts for like butters saying that they're low in cholesterol or cholesterol free, but what does that actually mean in plain English? Cholesterol is a substance that is used in your body to make new cell membranes, amongst other things. It makes hormones and things as well. So we do need some fat and cholesterol on our diet, but it's all down to what type of cholesterol we're taking in. So you've got two types. One's called LDL, which stands for low density lipoprotein, but you don't have to know that. And you've got another one called HDL, which stands for high density lipoprotein. Again, don't have to know what it's called. The main thing you do need to know is that LDL takes excess cholesterol to be stored in cells, and HDL takes the cholesterol to the liver to be processed. Now, if you think of TVs, I suppose, there's a good way of remembering which one is the good and the bad cholesterol. LD, or low definition TVs, nobody wants one of those because the picture's going to be blurry. HD TVs are much crisper and people seem to prefer them. So HDL is the good fat, LDL is the bad fat. The reason LDL is an issue, it will transport cholesterol to cells whether it has space for it or not. So think of it like having a glass that is already absolutely full to the top with water and then trying to tip more water in. Of course, it's going to overflow. Similar thing's going to happen to the cells. If the cell has already got a big store of cholesterol and the LDL comes along to deposit some more, it's going to overflow and start to accumulate on the outside of the cells and the tissues themselves. Let's have a look at that in a bit more detail then. So how does this cholesterol, how does coronary heart disease affect the heart? Now, if we think back to how healthy arteries, it's got nice thick walls with elastic layer in there, muscle layer. They can maintain high pressure due to this thickness, and the blood going through them is going at really high pressure as well. If you have a high diet of LDL or you have a poor diet, sedentary lifestyle, this can increase your risk of a build-up of cholesterol in your arteries and coronary arteries. We call this build-up a plaque. It's sort of a sticky, waxy, fatty substance. I'm sure if you took the time to Google it, you could find some truly horrific pictures to scare friends and relatives with if you wanted to. Over time or with age and not treating the underlying condition, so poor diet, having high cholesterol and having an unhealthy lifestyle, these deposits can actually completely block up these arteries or cause weaknesses in the walls. So this sort of sticky stuff will start to tunnel into the walls as it's running out of space inside the cells to be deposited. If you have a blockage, you're going to get no or less oxygen and glucose going to your tissues, so they're not going to be able to respire and may die. or if the fatty plaques start to affect the strength of the walls, they can weaken them and they can burst, and that's what we call an aneurysm. Let's think of this in terms of how it's going to affect the coronary arteries then. So if you have a blockage in one of these coronary arteries, which I've marked with a little cross, that means any areas of the heart that's supplied by that artery are not going to get oxygen or glucose, so they're not going to be able to do respiration. Those cells will start to die, and then that will lead to either a heart attack, so where your heart starts to shut down and it beats irregularly, or it could be total heart failure, so the heart stops working altogether, and that could ultimately result in death. Okay, so that's what it is and how it affects us. So let's look at a bit of a, silver lining or a brighter note. How do we treat it? If you want to treat something, you've got to treat the underlying issues first. So for high cholesterol, people are often prescribed a medicine called statin. Statin has been shown to reduce the LDL levels in the blood, so you're not going to get over depositing of cholesterol in cells that leads to the buildup of those big fatty plaques. It helps reduce cholesterol in the blood overall, and it can help with some other conditions as well. However, with all medicines, there are some side effects, and you do have to take them for the rest of your life for them to be effective. If you get to the state where one of your coronary arteries is blocked, then you're going to have to start to look at surgical options. So one of the things you can have is called a stent. So a stent is just a structure that keeps a blood vessel open that's become blocked or partially blocked by that fatty plaque. So what will happen is you'd have your artery with a big fatty material plaque on either side causing a restriction and stopping blood flowing through as well. What will happen then is the surgeon will thread through your blood vessels. I think they go in through a blood vessel in your leg. They're a long line with a sort of balloon structure on the end and a mesh cage. It's sort of like a mesh tube, like one of those finger traps you might have seen. I'll put a picture up to show what I mean. You've got the cage around this balloon on the end of this long line. They go into where they know the blockage is, so they'll be using some sort of imaging technology with this as well. Again, I'm not a doctor, so I'm not an expert. What will happen then, when they get to the blockage, they'll blow up that balloon, and that will cause the metal tube around it to get bigger. It'll expand, and then it will lock into position. So when they deflate the balloon and take the balloon out, the balloon goes out, but you're left with this structure holding the blood vessel open. It's going to push and squish that fatty material against the walls to keep it away, and then you've got a nice clear blood vessel for oxygen and glucose to get through. However, putting in something that is not biological, so made of metal, can increase the chance of clots forming on it, so you'd have to also take blood thinners whilst you had a stent as well. Okay, let's have a look at some other heart issues then. So if you had faulty valves, that's going to cause some problems. If you can't remember what valves do, now valves just stop blood flowing the wrong way in our bodies. It's make sure that our blood is moving efficiently, only taking oxygen in one direction where it's needed. So under normal conditions, when the valve's shut, blood can't pass through, it can't go backwards, it has to go forwards. People with faulty valves or damaged valves usually have symptoms of being tired more easily, feeling dizzy, having chest pains, being out of breath. This is all due to the fact that their blood is basically not working as efficiently as it should. They're getting less oxygen and glucose to their cells with every heartbeat, so there's going to be less respiration and the person's going to feel tired more quickly. This is all due to blood flowing the wrong way. So, how do we treat them? There are two main routes you can go down, but both involve surgery. You can have replacement valves either from a living donor, so this is donated by someone that has died, has been an organ donor, but if you use living tissues, they can wear out. I mean, they are made of, flesh like we are, so it is going to age as well. And if they are damaged, you're sort of back to square one and have to look for another transplant. Or you have the risk of the tissue being rejected by the body. So remember, if anything that is not made by you or part of you enters your body, your immune system is going to treat it like an attacker and try and destroy it or get rid of it. So you'd have to take medicines to sort of reduce your immune system a bit to give that tissue a chance. You could also have an artificial valve put in. So these are usually made of sort of plastics or metals. They do last a lot longer than the living valves, but just like with stents, you've got a higher risk of blood clots forming. You would have to take other medications for as long as you had that valve in place. Another issue that you could have with your heart is having an irregular heartbeat. So usually you have an area in your heart in the right atrium called the pacemaker. So it's the same as the same name as the artificial one. They are just bundles of nerves which send an electric shock down your heart to make it beat. So it will beat the atria first, and then it will beat the ventricles to sort of move that blood through in sequence. However, some people have issues with their pacemaker, so either it's not causing the heart to beat strong enough, it's not causing the heart to beat in the set rhythm. They usually have to have an artificial one put in. An artificial pacemaker just looks like a little battery pack with a long lead on it. Now, you would never see either of these parts if someone had a pacemaker, because they are both put in, into the person's body during surgery. When a pacemaker is put in, the leads are put into the heart and positioned where the normal pacemaker would be, and then those leads are attached to a battery which is put on the other side, the right side of the chest, to power those electric shocks. And what the pacemaker does is it shocks the heart just like the natural pacemaker would do, to make sure it beats in the correct rhythm and with the correct strength. Now, the batteries on these last about 6 to 10 years before they need to be replaced. For some people, a pacemaker is sort of a stopgap before they get a full transplant, and for other people they have a pacemaker for their lives without needing a transplant. It depends on the situation. Going down the transplant route is quite dangerous because it is very, very major surgery, so that would only be done as sort of a last resort. So the drawbacks with any sort of transplant, though, as we talked with the valves, is rejection. So unless you find a tissue match, and we talked about tissue matches in a previous video, I'll link it in the description in case you want a reminder. You need to find a tissue match, otherwise the heart is going to be rejected and that person could die, or at the very least to be back to stage 1. Right, and with that, we will leave it there for today. So in terms of what you need to know, you should make sure you know what coronary heart disease is, the main things that cause coronary heart disease. You need to know about stents and their treatment. You need to know about cholesterol, about pacemakers and valve replacements and transplants. No joke this week, because I genuinely forgot to make one, so I will leave it to you to find your own. If you find a good science-based joke, shove it in the comments and I will gladly read and laugh at them. Have a good rest of your week, and I will see you very soon.